Hello, my name is Tamika Hobson. I'm an LP and a BSN student at Indiana State University. This is my Nursing 444 Community Health Education project on breastfeeding. I ask that you pause the presentation at this time to take the pretest in the description box below. It is not going to record the results. It is just to assess your knowledge before watching the presentation. At the end of the presentation, you will be prompted to take that test again to assess how much knowledge you gained from the presentation. Please pause at this time. Now that you've taken the pretest, the objectives of this presentation is that after watching, you should be able to give the benefits of breastfeeding for babies, state the benefits of breastfeeding for the moms, recount the ideal time to initiate breastfeeding, name parts of the breast involved in lactation, describe ways to increase likelihood of breastfeeding success, and teach the perfect latch technique. Breastfeeding is what is natural for all mammal mothers to do for their babies. And because humans are mammals, breastfeeding is best for human babies because it naturally has all of the nutrients that they need to grow and thrive. Breastfeeding should be initiated ASAP after birth, ideally within the first hour. As soon as the baby comes out, you can put them right to the breast to start breastfeeding. The American Academy of Pediatrics and the World Health Organization recommend feeding the baby only breast milk for at least 6 months for optimal growth and optimal development. After 6 months, the American Academy of Pediatrics recommends breast milk in addition to solid foods until at least 1 year of age, while the World Health Organization recommends breast milk in addition to solid foods at least to 2 years of age. The longer the baby is breastfed, the greater the protections for the baby and mom that will be mentioned in the following slides. So how does your body make milk? Well, when the baby is put to breast, your brain releases chemicals called prolactin and oxytocin. The prolactin causes the alveoli or alveolus in your breast to remove all the healthy stuff from your blood and turn it into breast milk. The oxytocin causes the cells around the alveoli to squeeze and eject your milk down into the milk ducts so that your baby can suck it out. And this is the letdown that you feel is when they squeeze to release the milk. So the baby sucks. It signals your brain to release the prolactin and oxytocin. The prolactin produces the milk. The oxytocin squeezes it out. And the more your baby is put to breast, the more milk you will make. It's like a supply and demand. So the more your body thinks you need milk, the more milk it'll make. So the more you put your baby to breast, the more established your breast milk supply will be. And these are pictures demonstrating the perfect way to latch on your baby. It's the safest way to prevent like the least amount of trauma to your nipple and to make your baby more efficient at getting milk out of your breast, therefore establishing a supply that will continue to replenish itself instead of dwindling. And the basics are that you should hold your baby close to you, tummy to tummy, with your baby's chin touching your breast and your nipple lined up, and the baby should open its mouth wide and latch onto the nipple and the areola. Both should be in their mouth, and their lips should be flanged around your areola. That puts the nipple in the proper position in the back of the mouth so the baby can take nice long strokes and get milk out efficiently. So benefits for breastfeeding for the baby is that it promotes brain development. It creates a bond between the mommy and the baby. Breast milk is easy to digest because it's perfectly designed for human babies. It's always ready. You don't have to take time to prepare it. It has everything baby needs to be healthy. It helps the immune system. Breast milk decreases the chance of various illnesses such as ear infections, diarrhea, urinary tract infections, pneumonia, wheezing, bronchiolitis, bacterial and viral infections, and breast milk may also protect against future incidences of diseases such as obesity, diabetes, asthma, eczema, colitis, and certain cancers, and it decreases the baby's risk of sudden infant death syndrome. The benefits of breastfeeding for mom are that it's simple and faster for nighttime feeding and for feeding in general. The uterus returns to the pre-pregnancy size faster, and bleeding is stopped sooner. It burns more calories. Postpartum periods which tend to return later, helping to maintain iron stores and gives a little bit of natural contraceptives. It decreases ovarian and breast cancer risk. There's a decrease in bone fractures when the mother is older, decreases in osteoporosis risks. There is a decreased risk of type 2 diabetes, heart disease, and rheumatoid arthritis. And it's free, cheap. You have to buy some supplies to maintain if you're going to allow others to feed, but the milk itself, straight from mom, costs you nothing. Just mom eating a healthy diet, and that's it. To increase chance of successful breastfeeding, you should start preparing before you give birth. You should talk to your doctor or take a lactation class or ask your benefit representative work if classes are covered with your insurance. You should establish a support system, your partner, your parents, whoever is going to be helping you after you deliver your baby. That is very important because sometimes breastfeeding can be hard, and having someone to support you and reaffirm your decision with you is very important. You should have a birth plan in place so that you can include nursing right after delivery. Like we said before, that magic first hour that sets you up for success. Know that breastfeeding can be hard in the beginning, and if you go in with this knowledge, then it makes it a little bit easier to stick with. Get help if needed. If you're having problems latching the baby, if you're having problems keeping up your supply, get help. Local hospitals have lactation consultants on board. There are local government agencies that can put you in touch with lactation agencies. At the end of this presentation, there are resources for you to contact different places that can help you out and provide support or more information. And if you're returning to work, start pumping and storing milk for a stash as soon as you can, because that way you'll have less to stress about. If you're not producing enough for your baby to have in a day, you'll have some stored away that you can supplement that with. As a final statement, Dr. Ruth Peterson, the director of the CDC's Division of Nutrition, Physical Activity, and Obesity, said it best. Breastfeeding provides unmatched health benefits for babies and mothers. It is the clinical gold standard for infant feeding and nutrition, with breast milk uniquely tailored to meet the health needs of a growing baby. We must do more to create supportive and safe environments for mothers who choose to breastfeed. That way, babies get the best nutrition and the mothers get the support to provide that. That completes this presentation. Please take time to take the post-test found in the description box below. There's also information on Handout found in that box. And this is a list of all types of information for additional information and support for breastfeeding mothers. Thank you for watching this presentation. This is a list of all the references if you want to look back and check these out for yourself. Have a good day.